This is a Vortex mixer that is needed for COVID 4-plex testing. We delivered one of these to each of the 8 health centers. The Vortex is needed and is used as a high-speed mixer to utilize it for patient testing as well as for proficiency testing. And of course, make sure you have all your PPE on, which would be an N95, surgical mask, eye protective wear, gloves, lab coat of some sort. The Vortex mixer should be turned completely to the right for the max speed here. This is the on and off switch. In the center is off, down says touch. It would work when you touch it, and if you turn it on, it's automatically on the whole time. It should be on a flat surface, as you see. I like it at touch because you can just leave it on there, and when you're ready to mix your sample, you make sure the lid is tightly fastened, and then you touch it against the pad to make sure it's mixing the sample well. And I would mix for about anywhere between 10 seconds, maybe 10 to 15 seconds. Once you're done mixing, it's important to let it settle. As you see all these bubbles here. So you want to make sure prior to opening this tube, you let this settle for a moment before you inoculate the cartridge for testing. And this is to prevent any possible aerosols. So I would let this settle before I go and transport VTM, viral transport media, into the cartridge. And then once that settles, we would then open a Cepheid 4-plex cartridge. And the doctor then will take the pre-calibrated pipette, and it's pre-calibrated for 300 microliters. The doctor will open the tube once it's mixed, fully mixed, collect up 300 microliters in the pre-calibrated pipette, and inoculate the cartridge, the 4-plex cartridge, and then they will seal the cartridge.